mostly I'm pretty cruisy, but occasionally you have a moment where it just all comes out. You're sitting there and, you know, like I remember one time I was having a bath and just, yeah, you just cry, just out of nowhere. And you think, wow, you know, what if this and what if that? And yeah, it's really tough. There's a lot of what ifs, you know, at the end of the day. And yeah, whether it's fertility or whether it's the checkups or, you know, a bunch of other different aspects, you do get a lot of what ifs and you have a few moments. And I think that's part of it. You know, I'm glad I have those moments because otherwise I'd bottle them up and, you know, that's not good.
It was really great to be reassured by the breast care nurses and other people that that was normal, that you will have those days. And I still say, I still have those days sometimes where I have a bit of a black, what they call a black day or a blue day, and you will have them and continue to have them, and that's normal.
Cancer will always leave a scar. The scars are internal, they're emotional, they're intellectual, and they're physical. The physical scars are probably the least of the worries. But it's the emotional scar that people go through in terms of their journey.
My husband's kept me positive. He's a very positive person. He sees the treatment that will work, and that's as far as we should see.
It was through the district nurses who said to me, why don't you come into Sale? I was still on the farm then, and they're having a look good, feel better program. So I said, well, all right, I'll come. I didn't really feel I had to go, but I said I would go. Well, it was a great morning. And there we all were, sitting there, bald as badgers, and there was a lady with wigs and makeup and all that sort of thing. And I felt that it was an enormous help to some of the younger patients, but to me, I didn't really fuss too much. I couldn't be bothered with a wig, I just plonked hats on.
The support groups are a big help because you talk to other women and what they're going through, and it does help you to realise that they're suffering the same thing or they have the same emotions. I recommend it highly.
I play in a local golf club and they're a great bunch of ladies, and once again there's others in the club that have had cancer, so there's a bit of camaraderie there, of course, but also it's the support that you get from large groups.
I haven't had any contact with support groups, but I have a couple of friends that have had cancer themselves. So we've got together a few times and we've talked about similar experiences.
I've got a friend who I went to primary school with who's had cancer, and I catch up with her maybe once or twice a year and we sort of sit there and talk about it all. I think people that have had it actually understand, and you can tell someone till you're blue in the face, but they can't actually understand how it feels to have your body betray you and actually have cancer.
The most important thing that anybody can do is acknowledge the fact that we do need help through some very difficult times that are in front of us. And to attempt to beat them all yourself is tantamount to stupidity. The level of help and support that you can get if you simply ask for it is astonishing.